what is a verification jig? It's really just verifying that your master cast is exactly what is in the mouth, because full arch implants have no room for error. Like, crown and bridge, bridges, cement spacer, lots of units. There's a little bit of play for that stuff. But with 4, 6, 8 implants all splinted together, there's no room. So if your master cast is off just a little bit and you go build a big bar on it and it doesn't fit in the mouth, you're having to troubleshoot. So basically it's a cheap way to just go prove that your master cast is accurate. Here's how you make them. So you have your master cast, you put 4 either impression copings. These are impression copings for multi-units. You can use cylinders too. If you got a bunch of temporary cylinders, you can use those, either one. You're gonna make a little floss scaffold, so just run a bunch of floss around it, and then use some sort of material on the floss network to lock all these together. They say that you're supposed to use a material with really low shrinkage factor. So this is called like LC gel. It's like a pattern resin, kind of like Duralay. The pattern resins just seem to have really little to no shrinkage, because a core buildup material or a composite resin, when you cure it, it's going to shrink a little bit. And so that they say that if it shrinks, it's going to create some tension between your cylinders, which might mean it's not as passive. So this stuff is pretty cheap. It comes in like a flowable tube. I think it's called LC gel. It's red. It's pretty cool looking material. Lock them together, and then you can go and take this into the mouth. And if this slides passively into the mouth on the multi-units and it's passive on there, it's verified. So you've just basically proven that your master cast is good to go build on. And that's really all this process is. So, but the nice thing is, by doing the PMR and by picking up this prosthetic that was verified and pouring it up, your chances of having an unverified master cast or an inaccurate one are pretty low. So this is kind of like, this is what they always said to do when you were doing like traditional impressions. Take it or leave it. I've been skipping it and not doing it for a lot of cases when doing the PMR and been fine. But if you want to hey, I can't have my lab millibar and it not be accurate, and I'm a little unsure about my master cast if it's set up right, you go take 10 minutes and go make one of these and put it in the mouth and give yourself just peace of mind. So now you know how to do it and go kind of confirm your master cast. So if you make a verification jig and it's worked, you have what's called a verified master cast. Okay, so
you do that same appointment?
Yeah.
Run over and try it on your cast.
Yes. Yep.
Drops in, you're good.
Then it's good. You can do it in the same point. So patient's still in the chair. You got your master cast poured up, and you want to verify it. Throw on 4 jigs, 4 copings or cylinders, scaffold, lute it, take it into the mouth, put it in the patient's mouth. Okay, good. I'm good. And you can just skip another appointment. It's pretty fast to make those.
You don't need to use any screws in the base. Right?
So for this, so these, you do need to, you probably should screw it down. I would say you should. This is a long screw as part of an impression coping. So this is a long screw. This is called an open tray multi-unit impression coping. Okay. If you're doing cylinders, use a screw. Okay. You could skip it and just seat it on there and verify and look at it. But I would throw some screws on.
Do people understand too, though, once you put that denture up, it's the same thing?
Yeah.
The denture is rigid. So if the denture on your master cast fits, and then you take it right back to their mouth and screw it in, you just verify it.
It's exactly right,
so you
yeah.
really don't need to do,
yep.
That's kind of overkill right there.
And that's the whole PMR thing. The temporary is that, basically. Right. So this is overkill, but it's good to know how to do it. And that's why if you're doing the denture pickup, you can kind of trust it